There we go.
All right, well, good morning. Thanks everybody for attending today. My name is April. I am from Gibson, which is the insurance broker that partners with the county to help make sure that you guys are getting the best rates and the best benefits possible. Today, we're going to go over the benefit offerings for 2022, 2023. And if anyone has questions during it that are not specific to your health, please, stop me and we can discuss them. If there are any specific questions about, I'm on this particular medication or I have this condition, we can talk offline. So open enrollment is the one time per year that you can make changes to your benefits. So it's really important that you take a look now, make sure that what you have is what you want. The good news is there's no changes to the benefits. I actually have it listed here that the benefit changes on the telemedicine. This actually happened in January, but we wanted to remind everybody just in case it was kind of missed. Open enrollment is open this morning through June 6th. So if you are making any changes, you want to elect a new benefit, drop a benefit, change between single and family, anything like that, increase your life insurance, you have until June 6th to do that. If you don't do it during that time frame, you cannot make another change until next open enrollment unless you have a qualified change of status, which we'll talk about in a minute. A couple other things to do during open enrollment is just make sure your dependents are up to date. If you've had a child who's turned 26 and they need to come off the plan, make sure that's accurate. If you have another child that you want to add in, make sure addresses are up to date, beneficiaries tend to get overlooked. We had someone once who got divorced and remarried, never updated the beneficiary, passed away. Obviously, they're not here anymore to be upset about it, but the new spouse was not real happy. So again, any elections that you make now are going to be effective on July 1st, and they will remain in effect through June 30th. If you're making a change to your benefits, then you need to log into the system. The good news is because there aren't any benefit changes, with the exception of the slight changes to contributions, which Jody already communicated, you don't have to log into Navigator. So this is different than what's happened in previous years. So if you are happy with the benefits you have, you don't want to make any changes, you don't have to do anything. Anything that you have is just going to roll over on July 1st. So again, if you have a qualified change of status during the course of the year and you want to make a change to your benefits, you can do so. You have 30 days from the date of that event to let Jody know that there is a change. There'll be some paperwork you need to fill out. And those types of changes are marriage, divorce, you have a baby, you have a child's dependent status that changes. Again, that can be, they've aged out at 26, something along those lines. If you have a spouse that or child that passes away, obviously that's an event to remove that person. Commencement or termination of adoption. And then if you have a spouse or a child that gains their own coverage, so they need to come off of yours. So just a quick kind of review of your benefits. Again, no changes to any of this with the exception of the telemed, which happened back in January. On the screen, you've got 3 different plans listed. These are your 3 medical plans that are offered to you. I want to take a minute and just focus on definitions of a couple different benefit provisions that sometimes people get confused about. The first line is your deductible. This is the amount that you need to satisfy before the plan starts to pay. On your first 2 plans, the POS 250 and 2000, those are traditional plans. So there's going to be limited things that deductible applies to. Inpatient hospital stays, high cost imaging, those types of things have a deductible that applies. If you are having one of those services where a deductible applies, once that deductible has been met, then coinsurance kicks in. Coinsurance is cost sharing, basically. If we're looking at the 250, for example, you have a $250 single deductible. After you've met that deductible, the plan pays 80%, you pay 20%. You have the next line, which is called a coinsurance maximum. So this is if I am in that process, I've had an inpatient hospitalization, for example, and I met my $250 deductible. Now I'm paying my 20%. If I hit $500, if I'm again enrolled in single, the coinsurance is going to cap, meaning if I have any additional services for the rest of the plan year that fall into a coinsurance category, I don't have to pay anything. You also have an out-of-pocket maximum. Think of this as your safety net. Most people will never hit this, and we don't want them to hit this. What this is really to protect you in the event that you have a catastrophic medical situation. If you have a surgery that you have to go in for that's $250,000, for example, 20% of $250,000 is a lot of money. Or if you're on the HSA plan, you'll notice that doesn't have a coinsurance maximum. So you pay that deductible, and now you're on the hook for that 20%. If you didn't have that out-of-pocket maximum, you could pay, 20% of $200,000 is about 40 grand. That could bankrupt someone. So this out-of-pocket maximum is in place to protect you from that. Basically, if you do hit that amount based on whether you're enrolled in single or family coverage, for the rest of the year, everything from a plan standpoint is covered. You don't have copays, you don't have prescription copays, you don't have coinsurance. All of that is taken care of. You are set. The only thing you would continue to pay is the contribution that comes out of your paycheck to have that coverage. You're going to notice a couple different things when you look at the three plans. On the first two, we've got, again, deductibles and coinsurance. We've got that out-of-pocket maximum. But then you have a few things, your set copays. Again, this is like a traditional plan. If I go to my doctor's office, I pay my $30 copay. If I go to a specialist, I pay my $45 copay. Same for urgent care and emergency room. The only exception to those are going to be, if I go into the emergency room and they do an MRI and an EKG, I'm going to have my $250 copay, but then I'm also going to have the deductible and coinsurance that'll apply for those high cost imaging. If I'm just going in and they're doing a general checkup on me, they're doing my blood pressure, giving me some medication, all of that kind of basic stuff, then it's just going to be that flat copay. The HSA plan works differently. So an HSA plan is a qualified high deductible health plan. This is a plan that allows you to set aside money into a tax sheltered savings account. Kind of think of it as a 401k for medical expenses. And because it's set up that way to allow you to have some tax advantages, which we'll talk about in more detail in a couple minutes, the IRS puts some restrictions in place. With a high deductible health plan, you don't have copays. You don't have any of that. You pay everything up until the point that you've met your deductible. I'm on a high deductible health plan. I'll give an example. I'm on a medication that's $320 a month. I pay that $320 a month until I've met my deductible. Once my deductible's been met, then the deductible or the coinsurance kicks in. And that's going to continue again until I've met my out-of-pocket maximum. On all three plans, your preventive is covered at 100%. You don't need to meet a deductible. That's right off the bat. Those are going to be things if you've got kids that are your well visit exams. From a male standpoint, your annual physical, same thing from a women's standpoint. The only thing to keep in mind on that is if I'm a female and I'm pulling this out of the air because I haven't had enough coffee yet this morning, I think the age you start having mammograms, for example, is 45. So if my doctor says at 23, you need to have a mammogram, that's not going to fall under general preventive. So unless there is a family history, and so they want to move that up. And then there's some specific things they do on their end. If you ever go to see your doctor, they're in network, and you get a bill for preventive care, reach out to Quantum, which we're going to talk about in a minute, or Jody, and they'll be able to help you. Sometimes individuals in your doctor's office get confused. They code things incorrectly. Don't just assume, oh, what April told me wasn't right, and I'm just going to pay the bill. You shouldn't be getting a bill for that. Questions so far? You have out-of-network coverage as well, but keep in mind, anytime you go out of network, you're going to pay more. Your deductibles are higher, your coinsurance is higher. Doctors do not have to agree to accept the lower discounted rates that are negotiated. The other thing to kind of mention, and you don't need to go back on the slide, is regardless of if you're on the high deductible health plan or you're on one of the standard plans, you should never be, with the exception of your set copays, asked to pay up front when you're at your doctor's office. So if you have coinsurance or you're on that high deductible health plan, that claim should be sent in, processed, and then sent to you as long as you're in network. The reason for that is every physician that participates in the network has agreed to accept a discounted rate. So say your doctor charges $200 for a service. They've agreed perhaps to accept $120 through Aetna as payment in full. So that's going to go to Aetna, it's going to be processed, and then you're going to get an explanation of benefits, sometimes called an EOB, that's going to show you, here's the original charge, here's the discount that was applied, here's the amount that's still owed, whether or not you have a deductible, here's your portion of it, coinsurance, all of that will show and break out. This shows your medication copays. So again, if you're on one of the standard plans, the POS 250 or 2000, you have those flat copays day one. So if I'm going in for a generic, it's a $15 copay. If I'm going in for preferred brand, it's 30. Non-preferred brand is going to be 60. And there is a typo on that first line, that's tier 1. That's the same whether you are on the 250 or the 2000 plan. Yes.
Are there lists of generic or versus?
Great question.
Okay.
Yes. So in your benefit guide, there's a listing. You can go on SmithRx and it's called a formulary. And I believe in the electronic version, you should just be able to click the link and it'll take you right to that website. And then you can see every drug that's listed and which tier it's going to fall into. Something that I would say, I've been doing this for about 22 years now. Doctors don't, if I'm a physician and I'm sitting in a seat and you come in and you say, I've got high cholesterol. If you see the commercials that run on TV constantly at night, you know there's always a new drug on the market. These new drugs from an FDA standpoint do not have to be better than what's out there now. They just have to treat it a little bit differently. So that's not to say that that difference is better or that it's not better. I would always, always, always ask your doctor, is there a generic available? If there's not, is there a equivalent available? Therapeutic alternative is what it's called, which is not going to be chemically the same, which is what a generic is, but it's going to have the same formulation. It's going to work in a similar way. An example on this, when I was pregnant, I had horrible nausea. They called it morning sickness. It was all day horrible sickness. My doctor prescribed me a pill. I went to the pharmacy to pick it up. Here I am, this very large, very sick pregnant woman. And the pharmacy says it's $700 per pill. I lost it, called my doctor. He said, oh, well, that one dissolves on your tongue. There's a version that you have to swallow that was like $4 a pill. So that's an example. Different, better, I guess, maybe if you can't swallow, but I'll take the $4 pill over, so ask that question, have that conversation. Quantum is an excellent resource for that, as well as SmithRx. You can talk to them, say, is there something available that's going to work for me? It's not going to work for everybody, but for the majority of people, there's likely going to be something out there. The exception to that is going to be specialty medications. These are things that are hand mixed. A lot of times they have to be refrigerated. These are your very high cost cancer drugs, things along those lines. So those are going to be those bottom two tiers that are listed here. And you'll note that it says specialty pharmacy. So again, these aren't things that you can pick up at Walgreens. They need to be handled in a particular manner. And so that's going to go through a separate pharmacy for you. Anybody that's on maintenance medications, so something that you're on blood pressure medication, it's not something you're taking for a week. You're going to be on it for a while. You can take advantage of the mail order program. I would strongly encourage you to do so. You get a 3-month supply for 2 copays. They deliver it right to your house. and you don't pay shipping or handling. So saves you a trip to the pharmacy and a little bit of money as well. Prescription advocacy is something that you guys have in place that's not being taken advantage of quite as much as it should be. So I mentioned those cancer drugs. There's things like Humira and some other specialty medications that can be upwards of $20,000 a month. If I'm on a high deductible health plan, that's a lot of money for me to be paying out of pocket. So SmithRx has 3 programs in place to eliminate those costs. In most instances, you don't pay anything. So instead of paying my deductible, I'm not paying a penny. If it's not available to me for free, it's usually available at a significantly reduced cost. So the 3 different plans that are provisions that are included with this, the first one is called Patient Assistance Program. You may hear people talk about PAP. Basically, there are tons of grants and foundations out there that focus just on these high dollar prescription medications. And if you meet a certain income threshold, you can get your medication for free, usually for up to a year. This is not something that it's only the, minimum, people who are in that poverty situation. It's actually a pretty high amount that you can make to qualify for this. And a lot of people don't think about that. There's also a copay maximization program. So if you are not, qualified to take advantage of the PAP, it doesn't mean you can't get any savings. So copay maximization, another example would be when you're watching those, you're getting bombarded by those prescription commercials. A lot of times you'll hear them say, if you can't afford your medication, AbbVie may be able to help. There's a lot of what's called copay cards. So basically manufacturers will say, we know this is a really high cost medication. A lot of people can't afford it. We'll let them have this card that'll give them a $25 copay on it for the year. So that's another thing that's out there. If that isn't available for you either, maybe the manufacturer doesn't offer a copay card, then there's also international sourcing. So this is not where they're going to some little hole in the wall in a foreign country that, the guy's making it in his bathroom. These are, they have to meet quality standards. The medications are the same chemically as they are here in the United States. Canada is a big one. When you cross the border, the cost of a lot of these drugs, insulin, for example, is a fraction of what it is here. These are not things that you have to sit at home and go, April told me about this and this. I now need to spend 3 hours on the internet trying to find it. SmithRx will do that for you. They will reach out to you. So if you are on one of these medications or you're prescribed one of these, they're going to call you. They're going to say, hey, this is such and such from SmithRx. I'm your advocate. We noticed that you are prescribed or are taking this medication. If you'd like to take a few minutes, give us some information. We can work behind the scenes to get this taken care of for you. On that first one, the patient assistance program, there's some things they're going to ask you, your income levels, things that they need, but they're going to fill out the form for you. There's some information your doctor needs to provide as well. It's a relatively painless process for you and relatively quick. In the meantime, you can get the medication filled, through the regular pharmacy. But once this is taken care of, then you start qualifying for those lower cost alternatives. A big thing to stress is you have to respond to this. It's not automatic. So it's not going to be, we reached out to April, she didn't call back, we're just going to go ahead and do it for her. If you don't respond, they're not going that route. And you can be leaving thousands of dollars on the table. So please, if you see SmithRx come up on your caller ID, take the call. It's not a spam call, it's legitimate. And again, these folks are here to really help you. Questions on that?
Yeah, so you go to a doctor, they prescribe you something. You're saying when that goes through billing or whatever, they're going to pick up on that.
It's going to trigger. Yep, they're going to reach out to you. Great question. And if there is something that you're taking now and you say, maybe they reached out to me in the past and I ignored it, you can call them at any time. In the benefit guide and in this presentation, their phone number is listed there. It's actually on your ID card as well. Give them a call. Say, I'm on this medication. Is it something that's available for one of these programs? Can you help me? And if it is, they'll do it. Not every single medication is going to fall into one of those categories. They're specialty high cost drugs. So if my $300 drug unfortunately doesn't fall into that category, but if you are taking one of the more expensive drugs, they usually do. As a reminder, your telemedicine changed over. It's with Teladoc now. This was in effect January 1st. It's going to function much like what you had before. So if you're at home, you've got a kid that's sick, it's 1 o'clock in the morning, it's not severe enough to take them to the emergency room. Plus, you've got a $250 copay to go there, but you don't want to wait until the next day. Maybe it's an earache. You can call 24 hours a day, 375 days a year. This is available to you all the time. Pick up the phone and call, or you can do a video chat. They'll take some basic information from you. They have a screener. A physician will call you back. The longest that I've ever had to wait was 15 minutes. And that was, I think, Christmas Eve when they were really busy. Outside of that, they call back pretty quick. And it's just like a regular doctor's visit. They'll ask you questions. They can call in a prescription for you. Really simple and no cost for you guys, which is a very nice perk. Anybody that's enrolled on your medical plan has access to this. Care navigation, I've talked a little bit or mentioned a little bit, Quantum a couple times during this. Quantum is kind of like your medical concierge. They handle your medical and your prescription, and they are really there to support every aspect of this plan for you. So for instance, let's say you get diagnosed with type 2 diabetes. How much time do you get with your doctor? About 7 minutes usually. And you're supposed to absorb everything, get all your questions answered, and be content with the answers when you leave. What happens, you get to your car and you go, oh my gosh, I didn't ask this, I didn't ask that. What does this mean? You have a support team through Quantum who will take as much time as needed to answer questions, explain things. They'll do research and reach back out to you. They are really there to help you manage any chronic conditions that you have. This, again, is included with your medical plan at no cost. If you say, you know what, I need to order a new ID card. My child just turned 18, they need their own. They can do that for you. If you have one of those questions, like I had a preventive care screening and now I'm getting a bill for it, they can handle that. If you just have a question on an EOB, they can do that for you. If you say, you know what, I have the high deductible health plan, or even if you don't, and I need to have a procedure done, the cheapest isn't always the best and the most expensive isn't always the best. So there are a lot of quality measures that are in place. If you call them and say, I'm having a knee surgery, for example, they'll be able to go in, say, okay, these are the facilities nearby that are going to provide you the best level of care. They have the best outcomes, the least amount of recurrences from them. And here's what the cost is going to be. They can help coordinate all of that for you. So it's definitely a huge perk. If there is something like in the case of the example that I gave with someone who's newly diagnosed with diabetes, they will actually reach out to you and say, hey, we noticed that this situation just came up. Can we help you? Again, this is much like Smith RX. They're not going to continue to call over and over. If you choose to not engage or to not take that phone call, then it's not going to happen, but they are always there. So if you say, you know, April, talk to me about this, but I don't think I ever got the phone call, you can call them. Phone numbers listed in this presentation and also in your benefit guide. Health savings accounts. Again, this ties in with that high deductible health plan. These are phenomenal. So basically, it's a personal tax exempt savings account that you can use for healthcare. You can use it for medical, prescription, dental, and vision for any of your tax dependents. So if you're married, it's your spouse. And then if you have kids, it's going to be a tax dependent child. So that's a little bit different. We know on medical, dental, vision, you can carry them until they're 26, regardless of if they are married, live with you, doesn't matter. With an HSA, they have to be a tax dependent. So they're under 19, you're claiming them. As long as they are, you can use this money to pay for that. The money goes into your account pre-tax. It grows without you being taxed on it. And as long as you're using it for a qualified expense, you spend it tax-free. It's a really nice benefit. It rolls over from year to year. It's yours. You own the account. This is not owned by Sanilac. If you retire, you leave, you go somewhere, that money goes with you. Again, it's just like, think of it as a 401k for healthcare expenses.
And then it gets taxed if you took it out?
If you take it out for something that's not qualified,
Right.
it's subject to taxation and a penalty.
What do you mean by it grows?
It rolls forward from year to year. And if you hit certain thresholds, you start to get paid interest. You have the ability to do some investments. So the county partners with a company called PayFlex to administer it, but you do not have to go through them. So if you look and say, my bank offers HSAs, I'd like to have it there. They have a little bit better interest rate, or maybe they offer more ability to kind of have a different portfolio with investing that money. You can do that. You just want to let HR know, because they'll need to make sure they have a direct wire that goes over for that. But yeah, it can grow over, or you can say, like me with the $300 a month, I use the money from my HSA. And as long as, again, I'm using it for qualified expense, I'm not being taxed on that. You get a debit card when you enroll, so you use it just like anything else. There is no one that is going to be standing over your shoulder, making sure that you're using this for a qualified expense, though. So that's important to note. If I get into a pickle and I say, you know what, I need to pay this bill and I don't have enough money, I can pull that out of my HSA and use it. But I am going to be taxed on it and subject to a 20% penalty. So keep that in mind. If you happen to do it on accident, and this has happened to me, I pulled the wrong card out. I have two that look similar. I used it and then I went, oh my gosh, I paid for, I don't remember what it was, chips or something with my HSA. You can put the money back in there and then it's fine. So you don't have to worry about that.
Oh, that's interesting. You can buy other things with that.
Yep, it's yours. There's no one governing it.
At a grocery store for like vitamins and stuff, and it only paid for those vitamins. It didn't pay for anything else.
Was it an FSA or an HSA? It's probably an FSA.
HSA.
Was it the HSA here? So certain stores do have coding that they put into their system. Most don't for an HSA side. So that's probably a rare situation that store may have.
So I
it.
gotta be careful. I can't just swipe that card. Pay for it.
Yes.
Okay. Good to know.
Yeah, so be careful with that. Again, the rules associated with these accounts, you have to be enrolled in a qualified high deductible health plan, which the HSA plan here is. You cannot be enrolled in alternate first dollar coverage. So if I have the plan through the county and I'm taking the high deductible health plan, and then I also have my spouse's plan, and it is not a high deductible health plan, I can still take the high deductible health plan here, but I cannot contribute to my HSA. You cannot have first dollar coverage. First dollar coverage is anything that pays before you've met that deductible. Not just another medical plan like a spouse's medical plan if you're enrolled in a flexible spending account, which you guys don't have offered here. But again, if you have it through a spouse, it functions a lot like an HSA, but it doesn't roll forward. You don't own that account. If you don't use it at the end of the year, it goes away. And it's first dollar because if I elect $2,000, it's available to me on July 1st. I don't have to wait until that money is in my account. The other thing is Medicare benefits. So if you are eligible and enrolled in Medicare, that's a first dollar plan as well. So you can't contribute. If you have money in your HSA already and you end up qualifying for, say I take my spouse's plan, I've got $2,000 sitting in my HSA. That money's still mine. I can continue to spend it down or let it grow. I just can't put more into it. So the rule is around contributing. If I have one of those first dollar plans, I can't contribute, but the money's that's in there, I can still continue to use tax-free. Yes.
Do you mean personally contribute, say out of your payroll, or you mean the county's contribution?
Both.
Thank you.
Good question. Other things are going to be like military benefits, TRICARE, railroad benefits, anything like that are also first dollar coverage. You can now be claimed on another person's tax return. As young as everybody in this room looks, I don't think any of us are being claimed on someone else's tax return. And again, if you use it on a non-qualified expense, it's going to be subject to income tax and a 20% penalty. Deductibles, co-insurance, co-pays. prescription glasses, dental, services, anything that's not covered by your plan already, you can use and have as a qualified reimbursement under this. And when I say not covered, if I go in and I have a service and it's covered 100% by my plan, I'm not paying anything for it like your preventive. I can't then take the bill for that and submit it into my HSA and reimburse myself. So it has to be non-qualified. There was that link on the prior slide, and it's also in your benefit guide. There is a long, exhaustive list of things that are HSA qualified. You can log in at any time if you want. It's an IRS link though, so it's not the cleanest and easiest to read, but it's there. There's also another thing that's called, I think it's the FSA and HSA store. If you Google that, it's basically an online store that has pretty much everything that qualifies under an HSA or FSA. Sanilac County contributes to your HSA when you enroll in that qualified high deductible health plan. This amount is reevaluated on an annual basis. So these are the amounts that go into effect on July 1st. These are annual amounts. And the way that the IRS divides this is you have single and you have family, regardless of it's you and one person or it's you and 25 people. So if you have single coverage, you are eligible for up to $1,450. If you have family, it's $2,900. It's deposited on a quarterly basis directly into your HSA account. The reason that I say up to is if we have folks on the phone that are new hires, maybe they're not eligible for another couple of months. It's prorated based on your hire date. The IRS reviews annually and sets the maximums that you can contribute. So I can't just say I'm going to put $20,000 into my HSA because it's a great way to save on taxes. They annually say these are the maximums that you can contribute based on what level of coverage you're enrolled in. So single for 2022 is $3,650. Family is $7,300. That includes whatever you're putting in and what the county's putting in. So I can't say I'm going to put $3,650 and on top of that, I'm getting another $1,450 from the county. It's a combined maximum. Individuals age 55 and up can put up to another $1,000 annually in if you'd like to do so. If you get into a situation mid-year, you're taking a low-cost medication and midway through the year, you find out you are taking, your doctor's going to prescribe you a $300 a month drug. You want to have that money in your account. You didn't, kind of budget for it when you made your election. You can let HR know and you can change that HSA amount. Any questions on medical and prescription or HSA? Those are kind of the big ones. Any questions from anyone that's online? Okay. I'm going to go through the rest of the benefits kind of quickly. These are a little bit more common benefits, but again, if anyone has questions, stop me, let me know. You've got the same dental plan that you had last year, which is through Delta Dental of Michigan. Under this plan, you really have 3 levels of coverage to choose from. All of them are the same percentages, which some people can get a little bit thrown by. If you log into the Delta Dental website to see whether or not your dentist participates, you're going to see 2 different choices. You're going to see Premier and you're going to see PPO. This works a lot like the medical network. So if Delta says, say there's a service that's $1,000, like a cap or a root canal, Delta's going to go to the dentist and say, okay, would you accept $500 instead of $1,000? Newer dentists, maybe people who are trying to build up their book, these are going to PPO dentists are going to be the ones that say, yeah, we'll accept that. Premier dentists are going to be people who say, we still want to be in the Delta network, but we're not quite as comfortable taking $500. Maybe we'll take $750. And then you have folks that just say, like my dentist, I don't need to participate with any dental plan. I charge whatever I want to charge. So when you're looking on that website and you choose your dentist, major services are covered at 50% regardless. But again, it's 50% of 1,000, 50% of 750, or 50% of 500. So you're getting more for your money if you go to a PPO dentist. You have the basic services that are listed out here. Your preventive services, which are your cleanings and exams, are covered at 100%. Basic are going to be things like extractions, common services, those are covered at 75. Your major services are going to be things like crowns and bridges, dentures, those are covered at 50%. If you have children, they can get orthodontia up until the age of 19. That's covered at 50%. There is a $1,000 lifetime maximum per child that's having that orthodontia. In addition to that, you have an annual per person maximum for your dental services. So everybody that's enrolled on your plan can spend up to $1,000 per year covered by the dental plan. Keep in mind though, again, if I'm going and maybe I'm having 2 crowns and I'm having a root canal, it can way exceed that $1,000. I still get that discounted amount as long as I'm going to an in-network provider. Your vision, again, is still offered through VSP. You have in and out of network coverage through this. I've listed the in-network benefits here. If you use someone who does not participate with VSP, instead of showing your card and just having a copay, you're actually going to need to pay, submit an invoice or a receipt, and they'll reimburse you. The reimbursement schedule is not as generous as if you go to one of the providers. There's a lot of eye care providers, ophthalmologists, optometrists that participate. So if you go on the VSP website, you'll be able to see that full list, but you've got set copays for everything. You are able to get your exams every year. You're able to get your lenses and your frames every year as well. You have a set copay for those. You have specific lenses that are included. If I choose to get, unlined trifocals that are transitions and have all the bells and whistles, I'm going to pay a little bit more for those, but there are discounts. So if I'm choosing to get something that's over what's covered, I get a 20% discount as long as I'm in network. There's a hearing aid discount that's attached to that. So if you take the vision coverage and you are someone who needs a hearing aid or needs an exam, this is included free of charge. It's a discount program. And it is through a company called True Hearing. So if you go on their website, you can find information. Again, we've got it in the benefit guide as well. But basically, you can get up to a 60% discount on brand name hearing aids, up to 48 free batteries per year. And you get a 45-day trial period on the hearing aid to make sure that it works. So anybody that needs that, it's a nice perk. You've also got a nice basic life and AD&D benefit that's provided at no cost to you by the county. Police officers are entitled to $20,000, all other eligible employees $10,000. This is also matched with an accidental death and dismemberment benefit, which no one likes to think about. No one likes to think about this benefit at all, but it really is a nice protection. AD&D, obviously dismemberment is pretty straightforward, and we're not going to get into that because it's not what you want to hear at 10 a.m. But if the accidental part is nice, so if, I'm driving a car, I get hit by a bus, for example, that's an accident. My beneficiary would not just get the $10,000, they would actually get double. The AD&D portion is equal to my life, so they would get $20,000 instead. Again, a reminder, make sure your beneficiaries are up to date. If that 10 or 20,000 is not enough for you, you have the option and the ability to buy up through voluntary life insurance. This is extremely cost effective. If you're comparing to a whole life policy that you can get on the street, this is going to be a fraction of the cost of that. It is age banded, so every year your rate is going to increase a little bit as you get older. But I have only seen once where this was more expensive than a whole life. And it was an individual that was 92 years old, still actively working, and had a whole life, had a whole life policy from years and years ago. So this shows the amount. So for yourself, you can elect in $10,000 increments up to a maximum of $300,000 or 5 times your annual salary, whichever is less. And you have a guarantee issue amount for new hires. So obviously, everybody that's on this call is someone that's been here for a bit, but for new hires that hire in and at your initial eligibility, you should have been offered the ability to elect this coverage without completing EOI, which is evidence of insurability. It's health questions. If you elected initially, say you elected 50,000 and you say, and I want to up that a little bit more, you can do so, but you are going to need to complete that E of I form. You can do it online unless there's something that really jumps out at them. Most people are approved. I have high blood pressure personally, and so they flagged me. I had to get a blood test. They came to my home, they paid for the cost of that, and then they let you know relatively quickly whether or not you're approved. If you elect coverage for yourself, you can also do so for your spouse and or your children. Their amount cannot exceed what you have. And those maximums are listed here. And again, that's if I'm not electing coverage for myself, but I'm taking 250,000 on my spouse, it looks a little suspect. So they put that in place. You have some optional voluntary benefits as well that are available to you. These are through Mutual of Omaha also, just like the life insurance. You can elect voluntary short-term disability, voluntary critical illness, and voluntary accident. I am a huge proponent of the voluntary short-term disability. If you, whether you're working or you're not working, so it doesn't have to happen at work. If something happens to you, you're out with a knee surgery, for example, you could be out for a considerable amount of time. Unless you've got some money in the bank, you could be in a situation where financially you're struggling a little bit. You can elect this benefit. It pays you directly if you are temporarily disabled. You can have a benefit that is up to $500 per week or 60% of your salary. And you can elect that when you go into Navigator, you're going to see the different increments. So $100, $200. And the benefit pays for up to 13 weeks as long as you stay disabled. So again, very nice benefit. The thing I want to point out is that last bullet point that says 3-6 pre-existing conditions. So if I have had, we'll use maternity as an example. I'm pregnant. I'm not pregnant, but let's say I was pregnant. And I say, oh, I'm going to take short-term disability because I know I'm having this baby in a couple of months and I can take this benefit. There's a pre-existing condition. So if I have had treatment for a condition within the 3 months that I come on, then there is a 6-month waiting period for that benefit to kick in. Critical illness and accident, these are pretty straightforward. These are what you think of when you see the duck commercials on TV, Aflac. These are not insurance products. These are individual supplemental insurance. So if I encounter a critical illness, and there's a list of them, cancer, heart attack, strokes, it's going to pay me directly a set benefit amount based on what I elect. It's available for you, your spouse, and or your children. Voluntary accident for anyone that has kids. I strongly recommend this, especially if they play sports. Used it for my son, who is a little bit less than graceful, we'll say. If I have to take him into the emergency room, get an x-ray, really just every time I walk through the emergency room, as long as I fill out the claim form and I send it in, which is not anything tedious, I send it in with my EOB or my receipt, I get cut a set benefit that's a check that comes to me directly. So again, a really nice benefit. If you want more information on this, we've got some information out on Navigator, or talk to HR and they can get you more details on that. Employee assistance program. This is provided to you and anyone living in your household. So not just your spouse. If I've got grandma living with me, mother-in-law, whoever it is, they're able to take advantage of this. This is a counseling program. It's 100% confidential. So you don't have to worry about, I'm calling in because I'm complaining about my coworker who's driving me insane. Now Jody's going to know about it and be knocking on my door. No one gets any type of information other than we had 50 people call in and use the benefit. That's the only information that's available. They can deal with things like family and relationships, emotional well-being, financial wellness. If you're trying to get your savings in order, they can give you some basic pointers on that. If you're dealing with substance abuse and addiction, or if you have someone in your family that is, they can help you out with that. Stress, I put as the bottom one. I was going to make that bolded with everything that's going on in our world today. It's more common. They can also help with things as well, though, like elder care, for example. If you're getting to a point where you need to consider putting your parent into a facility, you can spend hours and hours and weeks because you want to make sure it's a good facility. It's budget friendly. You can actually call give them the specs. This is the area I'm looking at. These are the things we're looking for. They'll do that research on the backside, call you back and give you that information free of charge. So again, a nice way to really help you take some stuff off your plate and help from a mental standpoint as well. Lots of resources available to you guys because you're going to walk out of this meeting and go, she told me what? So there's a lot of things available to you if that happens. First of all, I'm here at 2:00 as well if you want a one-on-one appointment, if you have additional questions. But again, Quantum Health, remember, this is a great benefit. Take advantage of it, guys. Any questions that you have on medical or prescriptions, they are there to support you. Simple phone call away if you've got a question about, should I go to the doctor, should I not? There are nurses on staff. So take advantage of this benefit. Employee Navigator is also there. This has been there for you guys for a bit, but your benefit guide that you were given, we should put the presentation or a link to the presentation out there as well. You can log in and see what your current coverages are, your dependents, make updates, all the benefit summaries. So we've gone over a very, 50,000 foot overview of all of these benefits. There are, for the medical, for instance, I think the benefit summaries are each 4 pages. They go into all the different things, all the different benefits and specifics. All of that is out there. And then there are links to the different provider websites. Again, your benefit guide has a little bit more information on the back page. You have websites and phone numbers for all of the different carriers. So you've got it in one place. You've got it on your ID card for your medical as well. But this is everything, dental, vision, life, everything is included on there. And then, of course, you've got human resources available as well. So we really want to make sure that everyone understands their benefits so that they can make sure they're taking advantage and getting everything that's available to you. So your next steps, again, take a peek at the benefit guide, go home, talk to your spouse about what your options are, make the decisions that you want to, what you want to take. If you are making changes, log into Navigator by the 6th and complete those. Make sure you go through all of the steps. Your last page is going to be a confirmation page. Once you click that, your benefits are good. You can print off a confirmation. You can have it emailed to yourself, or you can just be confident that, yep, I clicked it, I'm good to go. If you're not making changes, again, you don't need to do anything. You don't need to log into the system. You are good to go. And if you are increasing your voluntary life or taking it for the first time, again, make sure you're filling out that evidence of insurability form. Because if I elect it, or I say I want to increase my voluntary life in Navigator, but I never do anything on the backside, again, it's like Quantum and Smith RX. You have to engage. If you don't fill that out, Mutual of Omaha is just going to close it and say, oh, April really didn't want this. It must have been a mistake. Questions?
Yeah, I had a coworker said that they used a place that was in network, and then that was on the list apparently, but then wasn't. So how often is that list updated, or do they have to commit for that year, or how's that work for medical people?
Most providers' offices will stay in for at least a full year. You don't see a lot of movement in and out. There's been some hospital systems, which I don't think have impacted this area a whole lot, but there's been a couple hospital systems that have kind of broken off and decided to do their own thing. If that happens, I would say reach out to Quantum, first of all, because sometimes there are things that process kind of funny. So something that passed earlier this year is called the No Surprises Bill Act. So if you go to a hospital, for example, for a surgery, and you say, yep, my surgeon is in network, there's no guarantee that the anesthesiologist, the radiologist, any of these other people are. What this bill does is protect you from those additional charges. So Mr. Smith, who's the anesthesiologist, can't come to you and say, oh, I'm going to pay you more, or I'm going to make you pay more because I'm not in network. So it's a little bit of that as well. If you had a procedure started and they were in network and they decide to depar and that procedure's in place, they can't go back and charge you more. So talk to Quantum, but to answer your question, there's not a lot of movement. Always check the website, but I always call and ask if I'm going to start seeing a new doctor as well, just to make sure. Some providers get confused too. You've got billing folks that don't know. We are in a similar situation with you guys. So you guys have a TPA that manages all of your claims, but you use the Aetna network of doctors. So when you're looking to see whether or not your doctor participates, you're looking on the Aetna website. When you give them your ID card, it has the logo for your TPA, which is Meritain Health, but it also has the logo for Aetna and it has the logo for SmithRx. Sometimes you've got a new billing person at the front counter who looks and sees the Meritain logo and goes, I don't know them. Or goes, oh, this is SmithRx. That's not a medical provider. No, we don't participate. So always ask that question. But like I said, to reach out to Quantum, work through it with them. And if you're still having issues, then circle back with Jody and she'll loop me in.
The costs are, as they were put on our plans, who determines those? The increased costs for the contributions?
Great questions. So from a medical standpoint, medical and prescription, the county pays for all of the claims that come in. So this isn't a situation where they're just paying $400 a month for all the single people and then the insurer is on the hook for it. So what part of our job is as an insurance consultant is to look at what all the claims were from last year, look at open conditions and project forward. Okay, based on that, this is what we think the cost is going to be. And then the county goes through and says, okay, based on that, these are what we're going to set the contributions at. And there are things like hard cap limits, which I don't know if you guys have heard about, but basically the state of Michigan comes out and says, you can't, charge or pay more than this specific amount for the year. And then HSA contributions are calculated into that as well. What I will say is you guys are paying an extremely competitive amount from your contributions. I have a couple of clients who pay like 50% of the single rate and their employees pay the full amount for dependents and spouses if they want them insured. So if you were to compare to other county governments, you guys are actually a little bit more generous than the other two counties that I deal with. But it's based on what that overall cost is, then broken down by how many singles, couples, families do we have? Here's what those rates are. And then the company is picking up, I don't remember the exact percentage, but I want to say it's over 80% of the cost of that. So your cost sharing amount is a small portion of that. I know every increase impacts you.
Right, and some, and it's a by plan
Yes,
and by category. So they didn't go up across the board the same. The single, double and the middle plan were up almost 42%. Where the premium plan for the 250 deductible is up 14%.
and some of that has to do with the way the claims are distributed, as well as what the benefit is as a whole. Your HSA plan will always be the least expensive because you're taking on more risk as an employee with that plan. The other two plans, we have to look at it and say, okay, maybe the 250 is a little bit more of a rich plan, but maybe we've got 80% of the claims cost that's being incurred coming from the middle plan. So how do we structure those rates to be proportionate for that coverage and what the plan has? Does that make sense?
Yeah, so it's determined on the claims per plan.
Yeah. Well,
So there
yes.
were more claims in the folks that were enrolled in the middle plan, so it went up 42%.
It's not quite that simple, but yes, we have an actuary that actually a third-party actuary, and I'm not going to act like I can go through we have like an 8-page report that we get that breaks down, okay, based on enrollment in this plan, claims in this plan, this is how they come up with that, and what they project forward as far as those claims. It's not just claims either. There's a lot of admin fees that come in play. So, there's something called stop loss. So if you have someone on your plan that hits a $2 million claim, the county can't cover. If you've got 10 people that hit $2 million, The next year, you're not going to be looking at the small increase you have now. You're going to be looking at 40, 50%. So there's a lot of different methods in place to manage that risk. So you buy what's called stop loss. So if you have a claim that's over a certain amount, that stop loss company pays for it. So that's a fee. There's a fee for the administrator. There's a fee to rent the network. So all of that is lumped into that actuarial evaluation, and you probably understand it more than I do. But then that's what they use to then break down and get the rates for each plan.
So the county in the end is the one who determines the increases.
Not really.
And they can't go over the hard.
Yeah,
either.
that's the other thing is the hard cap that comes into play. It's not so much the county because a lot of it, again, comes from the way that those claims are. So I would say the actuary, so Jody is not sitting behind her computer determining that single for the 250 is going to be $600 a month. And we're going to have employees pay, 150. The actuary is driving that based on, all of their analysis that goes into determining what we think the budgeted amount and the projected amount is going to be for 2022 and 2023.
So it's a projection.
It's a projection.
Thank you. I had an instance, and I know I can talk to you later on it, but it was a procedure. I had an ultrasound scheduled at a hospital and they wanted me to pay for it up front.
Yeah.
And I did, but I should have said no.
Yes.
Because they said that's going to be $265 right now. Do you want to pay that now? I said, I will. And then after it was submitted to my insurance, I received a check back for $195 back from the hospital because I had overpaid.
And again, some of that, most places know, most billing folks, I should say, know that if it's when they look and they see that you've got coinsurance or you've got a deductible, they usually won't even ask you for it. My doctor's office knows. Now we submit it all, but there are some people that don't know that. And so, yeah, if someone says, I need that payment up front, just say, no, I have insurance that needs to be submitted for the discount.
And they have no idea where you're at on your deductible.
Right.
Is it? Right.
Yeah,
Okay.
exactly. The only exception to that, again, is if you're going to a doctor that doesn't participate. So they are not in network. They obviously,
They're going to want their money.
they're going to want their money up front.
Thank you.
You're welcome.
Is chiropractic and massage therapy considered preventative? No.
No, I wish I keep trying to push for massage therapy. My kid has neck issues. So truly for him, it's a wellness type benefit that's not covered. The AMA and the government got involved in addition to the AMA, put together this extensive list of everything that's defined as a preventive benefit. Originally, it was the AMA. I think it changed 3 years ago where the government got involved as well. There's a specific agency. If you Google preventive, like Google 2022 preventive services or preventive schedule, it'll show up and you'll be able to see everything that's covered as a preventive service. You can get it covered as a benefit if your doctor writes a prescription and says April needs to have massage therapy once a week. It'll fall as a covered benefit, but it's not going to fall as preventive.
And chiropractic isn't either.
Not preventive, no. What else? Good questions. Everybody online is very quiet if they're still there. Okay. Well, if you guys think of anything else, let me know. Happy to answer any questions you
Thanks
have.
for coming.
You're welcome.
Can I help myself?